Okay, and again, thank you so much for having me. So my talk is a path to migraine wellness, and going to go through this. And please chat your questions in, I think, to Helen, right? And Helen will present them at the end, and I'll do my best to answer. So migraine. I think all of you are as familiar with this as I am. It is more than just a headache. We all know that. There is no cure to date. Sorry, I'm just gonna move this. Treatment has traditionally focused on medication. Going to try to open that up a little bit for discussion. How can migraine sufferers feel like they have control over their disease? And what are some ways to really find some resources and some support for migraine sufferers? So talking about this and thinking about it, we really want to try to break it down as much as we can. We want to start by understanding the science of migraine and the fact that genetic and developmental factors can contribute to people having migraines. Migraines are more common in women than in men. There's about a 3-to-1 preponderance. They tend to peak in the 30s and 40s. They can be present in all ages. There are descriptions of children with migraines, of adults in their 70s and even older with migraines. It is a clinical diagnosis, and what that means is that there's no blood test or biomarker specifically for migraine at this point. I do expect that to change within the next 5 years. I think there will be ways that we can demonstrate genetic abnormalities of people who have migraine and other factors. And I think some of you may be familiar with the fact that there really is a paucity of headache specialists. There just aren't enough people around the country who do the kind of work that I do and other migraine specialists. And I think it's really important to develop resources for migraine sufferers in so many ways, not just from the medical community, but specifically physicians, but in all aspects, so that people can receive really excellent holistic treatment. So what happens during a migraine? Well, the process can actually start 24 hours before you as a migraine sufferer actually feel anything. And sometimes when I share that with patients, they're really quite surprised. Things are changing in your brain well ahead of the start of your migraine, whatever that's going to look like. And some of the things that people describe: feeling tired, feeling restless, a sense of foreboding. Some people feel like they have to urinate. They know something is coming. This is really even before the prodrome begins. It's just this sense that something is going to happen and it's going to be different. The early sign of the migraine is really the prodromal stage. It's what happens before the ictus, the event of the migraine itself. You might feel nauseous, you might feel more photophobic, more sensitive to sounds or lights or even smells. Then some people, probably 1 out of every 5 people with migraines, will have the aura itself. And they will see something. A zigzag is the most common thing, or the little sparkles, the scintillations. Some people will feel numbness going up their arm or tingling in some way. They may feel weak on half their body or have vertigo. All of these can be part of an aura, and they're fairly common. So, you know, these are things to be tuned into. Hopefully your migraine treater will ask you about these things, but if not, please volunteer them when you do go for a visit, because they're important to know. Ictus is the Latin word for the event, the actual occurrence, and that's the migraine itself. You know, all of us on this Zoom, right? We know that a migraine is far more than just the headache, although that's really the declarative part of the experience, right? So it's the throbbing pain. It's often unilateral, one-sided. The word migraine comes from the Greek word hemicrania, meaning half the head. And so it's the knife or the poker going through your eye. Some people will show me, it's like these 2 points intersect on my head. It can start in the back and radiate forward, all kinds of different components. But in addition to the pain, or maybe in place of the pain, people will have other symptoms. They'll have nausea, they may vomit, they'll have sound or light sensitivity. And some of these other things that we've talked about, they can't think straight. They feel foggy, they have to lie down. Life can really grind to a halt. And again, I think all of you know that and have unfortunately experienced it. Then there's the migraine recovery phase, right? The postdrome, the aftermath. That can take 24 hours, and for some people even longer. What's going on in your brain during that phase is the reset. Okay, it's everything equilibrating back to the way that it should be. And for people who have chronic migraines, who are really in this state of just having very, very frequent headaches, it may be really hard to get through the postdrome, so that you're living in this phase of having headaches really fairly continuously, or having the recovery from headaches. So how do you do the things that you need to do in terms of achieving migraine wellness? Well, step one, recognizing what's happening and finding a medical care provider, realizing that it's not, quote, just a headache, right? That something else is going on, because migraine is a systemic process. Finding a medical care provider can be difficult. I certainly have heard, and I think my colleagues have as well, people are not always, doctors are not always tuned into what's going on with the migraine. If they're not a specialist, they might not know the latest and best ways to treat. I put a couple resources here for you. The American Headache Society has some information for patients and help finding a provider. The Migraine Research Foundation also has some locations. The United Council of Neurologic Specialties, I didn't put this on, I'm sorry for the oversight. UCNS lists everybody who's got a headache, every doctor who's got a headache specialty certification, who's done the additional training and testing to be certified as a headache specialist. So that can be helpful. It's also useful to ask friends, and here's where social media, if you have a screen that you're able to work with, can be really helpful. People in migraine chat groups, and I think we'll hear more about this, can communicate who's a good provider in any one given place, and people will share information. It's a great way for people to get information from other migraine sufferers and share that. Remember, 38 million Americans have migraines. If you are able to ask your primary care provider, some of them will know a migraine specialist and can refer you. And gynecologists for women patients, often because they are the ones who provide a lot of medical care to women, sometimes they will see their patients even more frequently than a PCP, they may have some good ideas too. So ask around. And I just really want to stress this. If the first visit is not a positive one, please feel empowered to keep searching for somebody who will hear you, who will respect you, who will work with you, who will meet you where you are to help you get the best care that you can. It is not your fault that you have migraines. The condition should not be minimized. We all know the expressions, it's not just in your head, pun aside, this isn't something that you're imagining or magnifying in any way. It is a real medical condition that needs to be treated properly and addressed with tremendous respect and knowledge. So you finally have found a migraine specialist that you want to work with. Then what? Well, here are things that coming through my lens, I find really helpful when people will come to the first visit, which now is pretty much all a Zoom visit, right? Because these are the times that we're in. If you can take charge, start keeping a diary, and it doesn't have to be anything fancy. It doesn't have to be on an app. You can just make a log. It can be on paper, whatever you want. But what's important, if you're a woman, what's your menstrual cycle? Is there a tie-in with your migraines? How are you sleeping? How are you exercising? How are you eating? What's your stress level? pandemic, not pandemic? What's that like? Is that a contributor? Sometimes people will send that to me electronically via our virtual gateway site in Epic ahead of the appointment. I always try to review those so that I'm familiar with where a patient is even before I've seen him or her at a visit or them at a visit. That's really helpful. Or you can bring it to the visit. It's harder now because so much of what we do is virtual. So having it in front of you, if you haven't been able to send it, and being able to say to the migraine specialist, okay, I'm having 10 migraines a month. Here's what this looks like. Study it yourself. Nobody knows your brain as well as you do. Make a list of treatments that you've tried. This is really, really helpful. What preventives, what abortive drugs, and so just to refresh for all of us, preventives would be a medicine that you might take every day, or with the newer injections, the biologics that my colleague Dr. Harriet will speak on, an injection once a month. What have you tried? What's been your response? What have been the side effects to the drugs if you've needed to stop them? Abortive drugs would be drugs that you only take when you get a migraine. What do those look like? Have you responded to different triptan medications? Botox, have you ever tried that? Onabotulinum toxin. Have you ever tried an elimination diet? I'm not saying that that's necessarily any of these things are the best for all people, but it helps me and it helps my colleagues when we want to deliver the best care to you that we can, to know what you've tried in the past and what's worked and what hasn't worked. So be prepared to talk about your lifestyle. Tell me how you exercise if you do. How do you hydrate? How much water do you drink each day? How conscious of that are you? How do you sleep? Do you go to bed at a regular time? Do you wake up multiple times during the night? How do you manage your stress? You're going to get some wonderful ideas for stress management, meditation, and yoga from my colleague Meredith Beatenstar, who's our integrative health coach at the Osher Center at Brigham and Women's Hospital in Boston later on in this session. And I'm excited for you all to hear that. So what do you do that's useful? What's the basic surround around you during your life? How are these things affected or not affected, and how do they affect your migraines? So we run these migraine workshops for patients called Migraine Toolbox. And some of my patients who may be on this Zoom may have actually tried them in the past. They're a 3-session workshop really focused around the idea of homeostasis. Homeostasis is a word that basically means keeping things the same all the time. So what I referenced a moment ago, getting regular sleep, eating regular meals, having plenty of protein, eating it consistently throughout the day, not letting yourself get hungry, finding some way, whatever it is, a walking meditation perhaps, some way to just bring that stress down a little bit, getting in some regular exercise, trying something maybe that you haven't tried before, but all kinds of things that help you stay as balanced as you possibly can. These are really important components for all of us, but especially for people with a migraine brain. Your brain is sensitive. Migraine is an inflammatory condition. Things that keep a steady underpinning help to decrease that inflammation. And so the more of them that you can incorporate, the better. And these are things that are important to talk about with your doctor, and that doctor or healthcare professional should discuss these things with you and explain them to you if you're not familiar with these different important components of well-being. Migraine brains do not like uncertainty. They want everything the same all the time. So while change is that much harder for all of us, if you have a migraine brain, it becomes even more difficult, right? So if one night you stay up till 1 a.m. for whatever reason, the next day you may trigger a migraine, and sometimes we can't help that. But the more you can do to keep things the same, the better, and the more that you can do to really improve your overall wellness, to keep your body in good shape with exercise, with nutritious foods, with things that are relaxing and distracting, the better. Scheduling your time, especially now that we don't have our typical get up, go to work, that may be better for people with migraines in a lot of ways, but still trying to adhere to some kind of schedule, making a list of what you're going to accomplish during the day, or how you're going to plan your times, and plan in your breaks, your meditation break, your exercise break, whatever that might be. And then there was a pandemic, and here we have a lovely picture of coronavirus with the little spikes here. Most of you've probably seen that. I feel like this statement here, then there was a pandemic, is the refrain for our lives right now. And I will share with you that I was on a Harvard Medical School call, grand rounds the other day, and heard Dr. Fauci actually say that within a year we will get our arms wrapped around this virus. And I found that really comforting, just to hear him say that. This is not forever, but the now that we are experiencing is so difficult. And when you have migraines, it's that much more difficult, right? There's stress of every type: family stress, job stress, getting your kids to virtual school or hybrid school or live school, finances. People have lost their jobs. They're living in such uncertain times. We all are. Loneliness, isolation, fear and anxiety around getting infected. It's all so difficult. And with migraines, after I've just spent the first part of my talk telling you all how much we need homeostasis, we want things to be the same. Let's face it, we can't make the stress of this current situation disappear, but there are some things that we can do. And my hope for all of you, all of us, during this time that we have together today is that we'll all learn some things, me included, that will be helpful and useful to keep ourselves in the best shape that we can be. So what happens with the pandemic? It's basically migraine mayhem, right? We lose control over all the things that we try to maintain in terms of our own wellness. What is the path to keeping ourselves during this difficult time as healthy and as equipped to handle a migraine as possible? Well, fitness really does help. And you don't have to go out and run or do a million sports or anything like that. But if there's a time that you can get out for a walk, and even if it's later in the day, some of you, I think, live in warm parts of the country. Some of us here in New England, we were talking before we began, we had snow on a week ago, and the temperatures were, like the middle of winter. They were in the 20s, but trying to find something that you can do. And now we're getting pretty good, all of us, right, at using virtual devices. There are some online meditations, mindfulness, different kinds of exercise. So being creative about that. How do we maintain wellness with our spirit, within our body, and within our mind? What we're really looking for is synergy with all of these things, right? And trying to figure out the best way to pull everything to a place of being as balanced as possible. So ideas that I try to share with my patients: work with your team, your migraine team. And that doesn't necessarily just mean your doctor. It can mean all the people who help you manage your migraines, from your family, your partner, your friends, your migraine buddies, your integrative health specialists. Make a schedule like I was talking about. Stick to healthy habits. Don't let yourself fall apart from those. There's a hilarious meme about stress eating that some of you have seen. Doing something that doesn't necessarily comport with your wellness plan occasionally is not the end of the world. What you want to do is swing it back as you're able to. Line up your care providers. Use your colleagues and use your resources as much as you can. See what can be accomplished virtually. We were talking, as I said at the beginning, before the session opened up, about virtual healthcare delivery, and really for people with migraines, the advantage of not having to get in the car, drive to a visit, sit in a waiting room, but to be able to be seen virtually if they can tolerate the screen, that really helps. And I think it's going to be part of healthcare going forward forevermore. Planning ahead, if you know you have to do something, what are the factors that you can add to minimize your migraines? And then really shoring up your support team and creating boundaries around things that you have to do and time that you need to maintain your wellness. So things that are not helpful on the path to migraine wellness: dismissive treatment. And I encourage people, if they've been treated in a way that doesn't comport with walking out of a visit or turning off the computer and feeling like they've been heard, forget it, move on, and use resources to find providers who will really treat you the way that you should be. Not helpful, being told that migraines are the least of it. Oh, there's a pandemic, people are in the hospital with illness X or Y. Well, that's awful and horrible, and having migraines is so difficult. So I think that, all of this can be important, but don't minimize your own experience. Not giving yourself space and realizing that your migraines and your wellness are important, and getting caught in an anxiety loop, so difficult. So trying to limit screens, and I put here, yeah, that helps, but let's face it, right now that's pretty much impossible. Can you get blue glasses? Do they help you? Can you put some kind of a screen blocker to minimize the glare? Can you adjust your overall lighting? Anything and everything that makes you feel better is important. I wanted to pause here and ask Helen if she could share that poll, if we have time to do that. And if not, I think that's fine. I wanted to see how many people have tried some of these different integrative therapies: chiropractic care, movement therapy. Oh, here we go. Okay, you're about to see a poll, I think, come up.
Sorry, hang on one second. Yeah.
That's okay. I'll read my list here: integrative nutrition and health coaching, acupuncture, craniosacral therapy, mindfulness. And I was just interested to see how many of you have tried these. Can you take a second and look at this as part of your migraine plan?
What is craniosacral therapy?
Thank you for asking that question. You know what? I will explain that. Let's hold that for the chat, and I will finish my slides. But it is a really interesting non-Western technique that I will explain in a minute. All right, so look at this. Look at the numbers here. Everything is nearly 50%. 46% Tai Chi, and that speaks to research that my colleague Dr. Rebecca Wells has done and other people have done, looking at the number of people with migraines who seek treatment, perhaps in addition to or in place of medications, that actually is what's now called complementary and integrative medicine. We call it KIM with a C. That is just so important to be able to include these things into your wellness plan. And again, I really encourage you to think about this and to talk to your treaters about it. Support from other migraine sufferers. You're about to hear more about this. I want to allow time for us to talk. So I'm just going to close with this slide on the agenda for today. We're going to hear about migraine advocacy. We're going to hear about new treatments in the pipeline, and we're going to end with meditation, mindfulness, and some chair yoga. So it should be a wonderful session for all of us. So at that point, I'm going to close my slides, and I would love to hear any questions. If we do have a moment, and if we need to move on to our next talk, that's fine too.
We have plenty of time to field questions, Dr. Bernstein. Why don't we start with the first one that came in about what defining the cranial therapies?
Yes, so craniosacral therapy is a kind of therapy. It's a hands-on, so it's a type of what's called body work. It's very, very gentle. Our craniosacral therapist who works with me and Ms. Beatenstar, who's going to be talking later, has told us that no touch is heavier than the weight of a quarter on your skin. So imagine a series of very gentle touches, starting with your feet, your hips, moving up your body, to try to create a sense of spinal flow and alignment. And it can be very powerful for people who have migraines. We're actually, we just got some funding to start a research project looking at that. So that will be something that we'll be doing in my setting in Boston. It is a little tricky right now because you can't really deliver that virtually. So that's something to stay tuned about, but perhaps at a later meeting, you'll learn more about it. So it is an absolutely lovely technique, and our craniosacral therapist now is actually able to do some sessions over video about just kind of letting go of some of the stress and tension that we hold in. So that may be an alternative, even if live visits are not possible right now. I'm sorry, Helen, I think your mic is muted.
Thank you. Yeah. To that point, I just wanted to mention that Miles for Migraine has extended their mindfulness series through the month of November on Thursdays. And you mentioned it includes a session, a Tai Chi session, art therapy, meditation, and yoga. And those are also, we've recorded all our prior sessions on our website so that you can do them at your own time. And I noticed that the Tai Chi instructor does do a series of light tapping and touching in certain points, which sounded familiar when you were mentioning that other therapy. So I encourage you all to please, you can view the mindfulness series on our mindfulness tab and take advantage of those recordings. Dr. Bernstein, a question did come in regarding, you made a mention of the list of doctors certified in migraines. Can you mention again where you can find that list, and I can put it in the chat?
Yeah, I am so sorry, everyone, that I forgot to include that in my slide. It's the United Council of Neurologic Specialties, so it's UCNS. So if you search UCNS headache certified physician, you should get a list by state, and it will enable you to see who's done this extra training, taken and passed the exam, and is certified as a dedicated headache specialist. So it's an additional board certification. And I wish I could say everyone who has that is going to, be a good match for you. Obviously I can't, but it does tell you that that person will know about migraines and about headaches and has done additional training and really has expertise specifically within headaches, because not all neurologists do, even though that's part of our training. It's not always the main part.
We had another question come in. One of our attendees had a very successful experience with acupuncture, a specific acupuncturist that immediately improved their headache situation. But after retirement, she has since been able to find a similar type of success. Do you have any direction on how you might find a good acupuncture for headache?
Well, if again, I would hope that your headache specialist could refer you to somebody who has that knowledge and expertise. And I would say to that person, if there's any way you can track down the person who retired and ask her if she's got a recommendation for you, that might be really helpful. It's kind of like with everything, right? Not all people have the same knowledge base and expertise. And while there are specific sites for migraine, we all know this one, or maybe not, I'll show you the web of your finger where you can press down here. They'll often put the needle there on the inside of your knee. There are other sites. If you have vertiginous migraine, there are specific acupuncture sites for that. not everybody is an expert. And so, I think that's where you could call ahead of making the visit and maybe say, how many migraine patients do you treat? How familiar are you with this? Try to do a little additional legwork ahead of the visit.
I might also suggest if you're on social media to hop on some of the migraine advocates and see if they have a suggestion. I mean, it's difficult because you need someone in your geographical area, but you might be able to get a suggestion by going on even the Miles for Migraine social media, the American Headache Foundation, the National Headache Foundation. You might be able to just put a question out there and see if you could get some recommendations. So could I ask you, Dr. Bernstein, to go back and elaborate? You made a mention about how, because so many people are on screens all day, some of your suggestions, I know one was the glasses, and I know a lot of people are having success with that. We also had a prior presentation mentioning there's a green light that was researched, that was introduced by a doctor that's conducted significant research out of Harvard. It's a green light, and you mentioned a blue light. So do you have any other recommendations for tolerating screens all day?
Yeah, so, it's interesting. I was talking with my own optometrist about this. He called it pandemic eye fatigue. Just the sense that all of us, from staring at a screen, it's really difficult. And if you have migraines on top of it, it's that much more, right? So one thing that I had always recommended to people, if you're using a desktop or a laptop, you can buy from Amazon or Staples a glare protector that just hooks onto the top of the screen that will cut out some of the energy. And so that is something that could be really useful. You can also buy film that looks like saran wrap, right? And so it's pretty inexpensive. And so if it doesn't work, it doesn't work, but you're not going to be out a whole lot. And you just put it across your screen, and that will block out some of the glare. The green light, some people have found success with that. I don't recommend that specifically, but certainly the blue glasses can be helpful for sure. And it may be that blue kind of, I guess it's the tinted saran wrap is another idea. I have had patients who've actually just covered up the screen so that I can see them, because the camera's on the top when they're doing a visit. But they can't necessarily, they don't have to look at the screen, and that feels better to a lot of people. But if your job requires you to be on the screen all day, 20, 20, 20 is the rule. So every 20 minutes, pull your gaze away, 20 feet away, and hold it at that distance for 20 seconds, okay? 20, 20, 20. And that gives your eyes a little bit of a break. So that's gonna help.
Great. Those are great suggestions. The 20-20-20, the glare screen, the sarans, and the glasses. And I noticed we had someone, thank you, Heidi, for mentioning the alley green light isn't supposed to be used with screens. And she has found adjusting the colors in the screen using f.lux helps get rid of the blue light. So great suggestion. Just one more question. I thought the poll was quite interesting and showed that a lot of people have started to integrate non-medical modalities into their treatment plan. But Dr. Bernstein, for those who haven't started and that just need, there was a lot of suggestions there, but if there was, what would be your recommendation for someone who perhaps hadn't tried something? Where would you suggest an easy way to start?
Yep. So the easiest thing I think to do is to do some kind of a meditation. And I used to teach this in my office, and now I teach it over Zoom, and Meredith is going to show you some of these things later on this morning. But kind of meditative breathing called cardiac coherent breathing can be very easy to learn. And so basically with that, you're breathing 6 total times a minute. You're breathing in for 5 seconds and out for 5 seconds. And the first time you try it, you got to count in your head, okay? The first time you try it, it's really hard to fill your lungs that much. But after you learn how to do it, if you can do 2 minutes of cardiac coherent breathing, what it does, it synchronizes your breathing with your heart rate, it slows everything down, and it actually physiologically pulls your attention away from the pain. or the stress that you're feeling and kind of repositions it. So easy enough to do that, right? Just count up to 5 and then back down. Do it 6 times. That's 1 minute. Practice it. Get used to doing it. It's the easiest kind of meditative breathing that I know, and I use it myself all the time.
Great, that's a great suggestion. We sometimes find, and we talk often, that everyone's non-medical journey takes different forms. So if you're just starting, sometimes just to begin with something that simple begins to incorporate, and then you go on and do perhaps a longer meditation series that's guided by someone. So again, thank you. Lots of valuable information there, and thank you for being with us today, Dr. Bernstein. I want to also take a minute and